So today we are speaking to Caroline Devine, who is a physiotherapist with the Intermediate Care team. Good morning, Caroline.
Good morning, Paula.
Caroline, supposed to start with, could you explain to us what is Intermediate Care?
Intermediate Care is a short-term rehabilitation scheme, and it aims to help clients to be safe and independent at home, avoid unnecessary admission to hospital, reduce the need for long-term care, and enable patients to leave hospital when they're medically fit to do so.
So can you tell us about your team and your role maybe?
Yes, we're a large team. We cover the whole of the Southern Trust. I'm a physio in the Newry and Mourne team, and I mainly cover the Newry and South Armagh areas. The team's made up of physios, OTs, social workers, coordinators, team leaders, and administrative staff. We work with clients in their own home, daycare centres, nursing homes, and residential homes. And at the minute, we're carrying a caseload of about 227 clients. So the physiotherapist role begins with an assessment of the functional ability of the client. We look at issues affecting respiratory system, muscle strength, joint range of movement, neurological system, their balance, mobility, and transfers. A home environmental check is carried out by the OT colleagues in the team, and prescription of equipment to improve safety and conserve energy and functional independence is also part of their role. They look also at the assessment of cognitive function, and also look at a request for a package of care if that's needed for the client. The therapists all work jointly together to create a manual handle risk assessment, and we also offer a carers assessment. The rehab support workers are an invaluable part of our team. They continue on with the home exercise programs that have been set for the clients, and set up our equipment, the practice functional tasks using the equipment that's been given that's new to the clients. They need a bit of practice, such as walking aids and using new dressing aids that they might have. The clients are reviewed frequently, and their home exercise programs and their packages of care are changed as often as required.
Okay. A large part of your role, Caroline, is helping with supporting patients with hospital discharge. Can you tell us just why it's so important for us to get patients home as soon as we can?
Well, a large part of our referrals come through the Discharge to Assess scheme, and this scheme aims to get patients home from hospital as soon as they're medically fit and it's safe for them to do so. We would contact the patients within 24 hours of referral, and arrange a home assessment and begin input. And most of them are seen on the same day, actually. We always need hospital beds, and they need to be available to those who need them the most. And the research shows there's great benefit to be had from rehabilitation being carried out in the client's own home. And an extended hospital stay can increase your risk of delirium, infection, and you can lose your mobility. So when you're at home in your own surroundings, you're with your loved ones, and you really need to be doing things for yourself, and with the right support, and it's the best place to get you back on your feet again.
And then your team doesn't just help people with the discharge from hospital. I know you've an increasing role in helping to prevent admission in the first place.
Mm-hmm. Yes, our team was able to work continuously throughout the pandemic, and this allowed us to build relationships with GPs and colleagues in other teams such as ICT, mental health team, physical disability team, learning disability teams. We've all other physio and OT and nursing and social work colleagues working in those teams, and referrals came in for clients in those teams who needed a bit of extra support. Maybe a few had falls, or their mobility and function was really slowly deteriorating. So these type of step up referrals have definitely increased since the start of the pandemic, because everybody's been trying to find alternatives for frail patients who didn't need to go to ED or be admitted to hospital. We're a 6-day service, and this has had a positive impact on those patients who have been referred on Fridays. You know, previously they would have had to wait to the start of the next week, but we're able to see them within 24 hours, you know, again. So that's definitely helping with discharges from hospital. We also provide AHP coverage to the Rapid Access Clinic in Daisy Hill. And this is a clinic where clients attend on an appointment basis. They've been referred by their GPs. And we also run an older persons assessment unit in Daisy Hill. And these clients are currently waiting in the ED department. They're fit to go home. And if they get the proper input on that day, they'll be able to go home on the same day. So they come round to our unit. We do a full holistic assessment from the AHPs, the nursing and the medical staff. And when everybody's completed their investigations, many of them are able to go home later the same day, and that's avoiding hospital admission again. And then we can follow them up through the intermediate care service at home if they need a wee bit more input.
Brilliant. Caroline, we've heard of many new ways of working and new developments that have emerged through the pandemic. Have you any examples you want to share?
Yeah, during the pandemic, some of our staff were working non-face-to-face. So that was an opportunity to look at all patients aged over 65 who had to attend the ED department for some reason or other. These clients were screened against a frailty criteria, and they were followed up with a specific need, you know, and anything that we could do in regards to advice, given details about access and information service, for example. Some were referred on to other services and voluntary agencies such as the Red Cross, you know, with the hope that the risks of their frailty could be detected early and, you know, the impact of that decreased as soon as possible. We also began virtual reviews on our iPads and telephone reviews, and that reduced the footfall of staff going into clients' homes and nursing homes and residential homes. For those clients whose needs could be met in that way.
Brilliant. Caroline, would you mind sharing how you look after your own physical well-being?
Yeah. I love reading. I love going to the cinema, like going out for a nice meal. I love caring for my pets. I have 1 dog and 4 cats. I'm part of my local church folk choir, St. Therese in Banbridge. So I'm really looking forward to getting back to the crack on a Monday night when we do our practice, and then getting to sing again at Mass on a Sunday whenever the restrictions are lifted. So my favourite pastime of all, though, is taking my children to see our 2 ponies, Aragon and Flynn, and they're stabled at my parents' farm in Ballyhinch. And I just personally, I think there's a great sense of fulfillment to be had. You know, when you're looking after a pet or an animal, and it involves you getting outside in all weathers, putting a bit of physical effort into it, and you know, it's a good way to switch off. Turn the phone off, and I would compare it to having a wee bit of mindfulness, a wee bit of time for yourself, because you're totally engrossed in what you're doing. You can't concentrate on anything else. So, yeah,
that sounds lovely. And I'm not going to ask you to sing now.
Good.
But you know, young or old, it's really important for us all to look after our own physical well-being. So suppose as a physio, I can't let you go without sharing a wee bit of advice and maybe some tips for us all.
Okay. My advice would be, if you can and it's safe to do so, get moving. Any form of exercise, be it a sport, going for a walk, moving when you're sitting down or lying in the bed, is great. You know, it reduces stiffness and it'll boost your cardiovascular and immune systems and build your strength. And it has a really positive impact on your physical, mental and psychological health and well-being. So hopefully when the good weather continues, it'll put everybody in the mood to go outside and do a bit of something like that. So
hopefully it will. Caroline, thank you so much for your time this morning.
Thank you, Paula.
It's been lovely speaking to you. Thank you.
Thank you, Paula.